It was important because she had a definite hormone change, and we were able to put her on medications that corrected that problem. It was not approved, but it's an off-label use of the medication, which we commonly do. It's safe, but it cannot be advertised by the drug company as a treatment for female sexual dysfunction.
I don't know how to explain it, but I know it's back, and I don't say, well, I got a headache.
Lily had a good response, but Dr. Castellanos warns that accurately diagnosing the underlying cause is vital. He also says that when it comes to diagnosing and treating female sexual dysfunction, progress is being made, but there's still a long way to go.
Most people that have discussed it with their family physician, urologist, or OBGYN doctor, if you really ask, the time between when it was first noticed and they got help was almost 9 years on the average. So what we're trying to do today is saying, hey, if there's a problem, address it early. It's easier to take care of a problem early than later on. Be aggressive. Ask your physician. Don't be afraid. Don't be embarrassed. There's nothing to be embarrassed about. Try to get help.
As many as 60% of all Americans suffer from some form of vein disorder, but women are more affected. Veins, usually in the legs, can get blocked and become enlarged, forming varicose and spider veins. They can be unsightly and can cause discomfort, even pain. There are treatments, but these aren't your grandmother's treatments. Treating varicose veins has gone high-tech.
I think any woman that has them would testify that they can be a drag. Very throbbing, very tiring, very painful at times. And if you don't have them, it's the same story. Walk in my shoes. If you don't know it, then you can't understand.
Jackie says varicose veins run in her family, and she's suffered from them for decades.
Varicose veins are actually normal veins that have become abnormally enlarged because of high pressure.
No one knows exactly what causes this, but there are several factors that can increase a person's risk.
The major risk factors for developing varicose veins are heredity. If your parents or siblings have it, you're much more likely to develop varicose veins. Female gender is one of the more important risk factors. We do see varicose veins in men, but they're far more frequent in women. Hormone changes, which are more common in women, and also hormone therapy might also be risk factors. Treatment should be considered when symptoms become poorly controlled by simple measures, like elevating your legs and wearing compression stockings and exercise. Exercise is good for your leg veins. The treatment options have changed quite dramatically over the last few years. For decades, the mainstay of treatment for varicose veins has been surgical stripping, which refers to quite an extensive operation to take out the large leaking vein in the leg.
I've seen people that had vein ligations through the years, and I didn't want that. So I decided to wait for laser.
What we do now is seal off that vein but leave it in place, and we do that with laser. The nice thing about the laser is that you don't have to have a big operation, you don't have to be hospitalized. The entire procedure can be performed in the office with local anesthetic and take away all the risks of general anesthesia and hospitalization.
A few months ago, Jackie had this less invasive higher-tech treatment called endovenous laser ablation on her left leg.
I didn't know what to expect, but he said it was painless, and it truly was painless. And you can't believe how good your legs feel afterwards. You can just, you just have so much more energy.
Today, Jackie's having her other leg done.
I'll take some pictures because they're going to be gone quite soon. If you leave varicose veins, they never improve spontaneously. They always worsen. And the end stage is persistent swelling of the leg, a brownish discoloration of the skin, particularly around the ankles, and as the skin becomes thicker, it gets further and further from its blood supply, and the skin can break down, resulting in ulcers in the skin that take months to heal and often recur. In the worst cases, it can even lead to amputation.
Insurance does cover the laser ablation procedure, which can cost as much as $2,500 per leg. And what about people who may think treating varicose veins is purely for cosmetic reasons?
No, it isn't. Not when you live with them for all these years. It isn't cosmetic, trust me. Not for me anyway. It's relief of pain.
A less serious but more common condition, often confused with varicose veins, is something called spider veins, often caused by an injury or trauma to the leg.
These do not typically bulge. If they do, it's only minimal. They're much smaller, in the order of 1 or 2 millimeters in size. They can be very fine and reddish, or slightly larger and bluish, and they are less commonly symptomatic. They're more often treated because they're unsightly.
Spider veins can be treated relatively risk-free using an external laser or through injections. These, however, are not typically covered by insurance.
If left untreated, they progressively worsen, but they have no serious health risk.
Both spider and varicose veins are relatively common concerns, affecting up to half of American women. Luckily, these and other current treatments have very high success rates.
Health issues that affect women aren't just those related to reproduction and fertility. And women often are overlooked or undereducated about a wide variety of health conditions. I hope we've been able to offer some insight into just a few of these concerns. Remember, nothing is more important than arming yourself with the most accurate and current information. And knowledge, combined with action, is power. For Health Sense, I'm Chris Curl. Thanks for watching.
To order a video of this program, call 1-888-824-0030 or visit our website at wgcu.org, and please refer to the program number on your screen.